redness, there shouldn't be anything leaking out from around it, they shouldn't be wet with urine. When you clean a catheter, you hold the catheter at the meatus, which is where it goes in, and you wipe that tube 4 inches away from the body. Never wipe up toward. So we wipe away from the body for a catheter. Now for perineal care, whether they're male or female, we wipe down in the front and up in the back. And I'm gonna demonstrate both. But whether they're male or female, down in the front, up in the back. Now if your resident's female, I'm gonna kind of do it up this way. You wanna separate the labia, wash the urethral area first, which is down the middle. So we're gonna use the middle of the washcloth, down the middle. Downward strokes in the front. We're gonna wash in downward strokes inside and outside the labia, working out this way to the thighs. So downward strokes, inside and outside the labia, working out. We're gonna stop, change all our stuff. So get new water, new washcloths, towels, gloves. Come back. Rinse in the same direction. Down, inside and outside the labia, working outward to the thighs. And then pat dry. If you have a male, get these out of the way here. I'm gonna put these in my barrel over here. If you have a male, some males are circumcised, some are uncircumcised. So if they're uncircumcised, you're gonna see skin coming up over the tip of the penis. You have to pull that skin down toward their belly. This way the head of the penis will expose, it'll expose the urethra, and we can get them clean. If you don't see skin coming up, then you don't have to worry about that stuff. They were circumcised, the skin was removed. So for a male, pull back the foreskin if they're uncircumcised. Start at the tip of the penis, using a circular motion going down to the groin and working out from the thighs. So tip, circular motion, down. Wash. Rinse, same direction. And then pat dry. Circular motions down, out to the groin. And then stop and get new water, gloves, washcloths, and towels. So that's the difference between the male versus the female perineal care in the front. Now perineal care in the back is the same, male versus female. So have your residents roll over into lateral position toward the raised side rail. One, two, three. After we wash the genitals in the front, we're going to wash the anal area. Male or female, one direction, up in the back. So take your soapy washcloth, wipe from front to back, wash. Front to back, rinse. Front to back, pat dry. And we definitely need to get new stuff because we just cleaned the anal area. So get rid of your towels, washcloths, change your gloves, wash your hands, get clean water, clean towels and washcloths. Take your soapy washcloth, and we're going to start at the neck, washing down the back to the buttocks. Wash. Rinse. Same direction, neck, back and buttocks. And then pat them dry. Neck down to the buttocks. Change your gloves, wash your hands, new gloves on. Bring your resident back into supine. Now we're going to undrape the resident. Bring the sheet and the blanket up over the bath blanket. Slip the bath blanket down to the foot of the bed. Get your clean gown. Put your clean gown on. Cover them up. Remove your linens. Put them in your linen barrel. Take them out of the room. Take off your gloves. Wash your hands. You want to report any rashes, abrasions, which is just a fancy word for a scrape, or bruises to your nurse. Put your rail up. Drop your bed down to the lowest level. Put the rails back down where you found them. And then do your final steps. A, check your resident's alignment, make sure they're comfortable. B, make sure your bed is in the lowest position, side rails is appropriate. C, make sure they have their call light and water. D, ask them if they need anything before you go. And E, everybody likes a thank you, so thank the resident. Find and gather your supplies, clean them to company or facility policy. H, ask your resident how they want their hanging curtains, open or closed. And then eye your way out. I'm going to wash my hands. I'm going to do a visual safety check of the resident environment, report unusual findings to my nurse, and then document my procedures. Thanks for watching. Hi everybody, it's Jenny from MedEd, the CNA instructor. So the next procedure I'd like to go over with you is how to give somebody a back rub. So when you're doing a back rub, get your initial steps, ask your nurse about your resident's needs, abilities, and limitations, knock on the door, request permission before entering. Introduce yourself by name and title, greet them by the name they prefer, explain what you're going to do. Find and gather your supplies. So for this procedure, I've got my lotion. Close the hanging curtains, drapes, and doors. I'm going to wash my hands. I'm going to wear gloves as needed for body fluids, and I'm going to use good body mechanics. So to give a back rub, you want your resident in supine. You want to bring the bed up to your waist. And then lower the side rail on the side that you're standing on. Assist your resident into lateral position facing away from you. 1, 2, 3. expose their back and shoulders. Take lotion, put it in your hands, warm it up, and the motions you make, you start at the buttocks, make smooth motions up over the shoulders and arms, and then circle your way down. So I'm going to start at the buttocks, I go all the way up over the shoulders and upper arms, and then circle down. So this is kind of like a wax on, wax off kind of thing. Up, circle down. Going up over the arms and shoulders, and circling down. I would do that for about 3 to 5 minutes. If my resident had excess lotion on their back, I would pat it off because we don't want moisture. Put them in the position they request. Lower your bed back down. And then do your final steps. A, check your resident's alignment. Comfy. B, make sure your bed's in the lowest position, side rails as appropriate. C, make sure they have their call light and water. D, ask them if they need anything before you go. And E, everybody likes to thank you, so thank the resident. F and G, find and gather your supplies, clean them to company or facility policy. H, ask them how they want their hanging curtains, open or closed. And then you're gonna eye your way out of the room. I'm gonna wash my hands, I'm gonna do a visual safety check, I'm gonna report unusual findings to my nurse, and I'm gonna document. Thanks for watching.